I had heart surgery when I was 15. And instead of scaring me away from the hospital, it brought me to it.
I guess I go home with every day is that I've helped somebody.
I wanted the experience to be able to give back to my community.
There are so many opportunities in nursing for American Indians. We need more American Indian nurses to work in various capacities on and off the reservation.
American Indians in North Dakota and the surrounding states continue to experience major health disparities. In fact, this region has the shortest average lifespan of American Indians in the U.S. And while research-based causes have not been established, many believe this gross disparity is due to inadequate health care. Across the United States, there is a large need for skilled American Indian nurses, and that is most evident in North Dakota. Compounding this issue are the significant healthcare needs of tribal populations throughout the state, and the preference of American Indian patients is to be cared for by those who share similar culture and values.
I chose nursing because I love helping people. I just really have a passion for helping people, and I've always been interested in the medical field, so when I put those two together, nursing was kind of the obvious choice.
I chose nursing because I really like the diversity and the different routes you can take with nursing. I mean, you weren't stuck in just one field. You can go in many different directions, and I also like the one-on-one care you can provide for the patients.
There's not just, a nurse in a hospital or a nurse in a clinic. There's so many different options out there.
You'll always have a job. You'll always have a job, and it doesn't have to be in the hospital all the time. So you can use that education in a lot of places. It can open a lot of doors for people.
It not only teaches you about your career in nursing, but it teaches you how to be a good person, like a strong and fight through something and complete something, and it makes you feel good about yourself.
I take a lot of pride in my culture, and I'm proud to be an Anishinaabe Ikwe, and that means an Indian woman, an Ojibwe. And I don't know, I believe in leaving a legacy, and I want my kids to never think that they're not smart enough. Because I went through that phase, and I feel like I could take on the world. Because I got this far, and there's no looking back.
I came 3 days before classes started, and it was one of the worst mistakes I could have ever made. Nobody told me that you're supposed to read your syllabus, you're supposed to have this done because you're gonna have a test the next day, literally. So that was a big challenge.
Missing birthday parties back home, not being able to come home for an anniversary or a grandparent's birthday, or that was kind of some stuff that weighed heavy on me.
There's times when I can't attend family functions because there are school priorities, but they understand. And it's hard to have to miss those times when I know everyone's together at grandma's and I'm not there, I'm here in Bismarck, but I know that ultimately I'm doing something that is going to be good for all of us.
I lost my husband my junior year in college. He was killed in a motorcycle accident. And my third son was born 13 days after he died.
Nursing's leaders recognize a strong connection between a culturally diverse nursing workforce and the ability to provide quality, culturally competent patient care. But health personnel shortages can negatively impact healthcare quality through reduced healthcare access, increased stress on providers, and the use of underqualified personnel.
Now, if she were to have asthma, what kind of lung sounds would you hear?
Wheezing?
Yes, it's very common in asthma.
We would get the everyday diabetic patients, the hypochondriacs, the med refills, or we'd get a car accident. We had to be that versatile.
I think I had a lot of role models everywhere I worked, whether it was in the private sector and IHS. There was people that I knew I could look to, and they really, really held nursing to a high standard, and I really liked working with them.
It was kind of unusual for some of my coworkers because I was the only minority, I think in the whole hospital at the time, as a nurse anyway. And I knew the stereotypes going in. Native Americans are lazy, don't like to work, that type of thing. So I worked twice as hard. I picked up twice as many shifts. I was there on time, even early.
For the first few months, I was kind of hard on myself, like, okay, well, this nurse knows this and this and this, and why don't I know that yet? So I think getting to that aspect of feeling comfortable to where I am with what I know now, and then always trying to achieve more. Working in the NICU, when you expect a healthy pregnancy, there are some times where you're going to have the losses. And so dealing with that as an emotional hardship. It's hard for you to be strong and be supportive for that family, but at the end when they come back a year later and they have that Memorial Day for their baby, or what would have been that baby's birthday, they appreciate everything that you've done, even the smallest things, from taking pictures of their infants, holding their hands when they're getting the news and things like that. It's been an emotional roller coaster for me and for the families that I've been involved with, but I wouldn't change it for the world.
Some of the main things is to keep in mind that a lot of the vital signs are going to be different.
My goal in nursing school was to come back and serve my people. So that's what I want to do, and that's what I'm doing right now.
I always knew that I wanted to come back and help my people.
I wanted the experience to be able to give back to my community, go out and help people, educate people.
Don't hold it off or push it off and be like, oh, I'll go next semester or I'll go next year. Get it done right away. Then you can get those years of experience under your belt and maybe even think of going into a master's program.
Don't let somebody tell you that you can't do it. Don't let yourself tell you that you can't do it, because even though you're going to go through those challenges, there's always something more out there for you. There's always somebody's hand who's going to be reaching out there for you. There's another person who's gone through what you've gone through. And even just opening up and talking to those individuals, I feel like you'll be able to succeed beyond even your own expectations.
Don't be scared to make a phone call and say, you know, I want to go to college. How do I do this? Call the college and talk to even anybody in the office and say, how do I do this? Don't be scared. There's resources and there's help everywhere you go. So just use those resources and have some confidence in yourself and say, you know what? I'm going to go to college.
You got to keep pushing. It's scary, it's tough, it's a lot of work, but if you have the drive and the determination, you're going to do it. You're going to get there. Just keep working at it. You're going to have setbacks at times. It's not if it's going to happen, it's when it's going to happen and how you deal with it.
Sometimes you think, oh my gosh, why am I doing this? But I think just, not giving up and, leaning on your support system. Some people feel like, oh, I need to do this on my own. I need to, be independent. I can't rely on anybody. But, nursing school causes enough anxiety as it is. So you need to turn to your support systems and sort of lean on them sometimes.
I try to meet with my instructors to let them know that I care about my grades and just to show that I'm active. And then I try to use the resources available to me on a daily basis.
Males into nursing, there is a stigma as far as becoming a nurse and, working as a nurse and that kind of stuff. And to tell you the truth, I get more compliments being a male nurse than anything.
Once you set your goals and you really decide that's what you want to do, and in your heart that's what you want to do, you'll do it.
I feel like now that I have the confidence and I came out and I worked hard and I did everything I need to do, it's an open road out there. I can do anything now. Anything I put my mind to and some hard work, you can do it.
It's probably the best job you'll ever have, but your heart has to be in it.
If you want it and if you really want to do something like this, I have 110% confidence that you'll be able to succeed.